So good evening guys, myself Dr. Omkar Sangita Deleprasunone and I welcome you all to this session of Sparks. The next session is Pharmacology MCQ discussion. As you all know, you have been updated in the Telegram groups about this MCQ discussion series that AFMG will be undertaking, and this is the first session that we are initiating. So first of all, today we'll be discussing about General Pharmacology, the questions you have already received in your Telegram groups. I hope you have gone through it, you have solved them, and let's begin now with the discussion itself. Okay, so we will be discussing all the 20 MCQs that were given to you. Okay, so let's begin without any further delay. So the first MCQ guys that came was, which among the following statement is true about the given dose response curve? Okay, so please remember the below given is your dose response curve, rather it is your log dose response curve. Okay, so important one to be remembered. Please remember about dose response curves, always, like almost on alternate examinations there have been questions from General Pharma. So what we need to remember from the dose response curve is that, please remember the dose response curve or the DRC, उसका शेप क्या होता है, दैट इज़ वेरी मच इंपॉर्टेंट टू बी रिमेंबर्ड. ओके, सो डोज रिस्पॉन्स कर्व का शेप होता है नॉर्मली हाइपरबोला. प्लीज रिमेंबर डोज रिस्पॉन्स कर्व इज हाइपरबोला, whereas if we take the log of these dose response curve, अगर हम log DRC की बात करें या log dose response curve की बात करें, then इसका शेप कैसा हो जाता है, then the shape becomes sigmoidal. So please remember, इस पे क्वेश्चन था ऑलरेडी. ओके, सो डोज रिस्पॉन्स कर्व इज हाइपरबोला शेप्ड, whereas log dose response curve is sigmoidal or S shaped. Okay, please remember hyperbola is something like this and S sigmoidal is something like this. Okay, important. Then so the question was, which among the following statement is true? Let's see the log dose response curve which is given in the below image. Okay, यहाँ 4 ड्रग्स के बारे में दिया गया है. Okay, so what we can see, दो important parameters हमें actually देखने होते हैं in log dose response curve. And what are these most two important parameters? These most two important parameters are nothing but efficacy and potency. Okay, both these parameters are efficacy and potency. Efficacy कैसे पता लगाओगे? So please remember the height of the graph corresponds to efficacy. जितनी ज़्यादा height उतनी ज़्यादा drug efficacious होती है. Okay, so here हमें क्या दिख रहा है? That drug A has the highest height. Like drug A का जो ग्राफ है वो सबसे ऊंचा है, right? Therefore drug A is the most efficacious drug. Okay, so please remember efficacy is nothing but the height of the graph. Okay, so height determines the efficacy of a drug, whereas potency is determined by the side. याद रख लेना, पोटेंसी मतलब क्या कि कम से कम डोज में ज्यादा से ज्यादा इफेक्ट लाना. दैट इज व्हाट इज पोटेंसी. पोटेंसी मीन्स नथिंग बट पावर. P for potency, P for power of a drug. Okay, so in minimal concentration maximal effect is seen and that is what we call as potency. यहाँ पे क्या पता चल रहा है हमें? सो प्लीज रिमेंबर, जितना ड्रग ज्यादा, जितना कर्व ज्यादा लेफ्ट में होगा उतनी ड्रग ज्यादा पोटेंट होगी. जितना कर्व ज्यादा राइट में होगा उतनी ड्रग कम पोटेंट होगी. ओके, प्लीज रिमेंबर potency is more towards the left side and less towards the right side. Okay, please remember the graph towards the left side would be more potent, whereas the graph towards the right side would be less potent. Okay, that is very much important. And the drug with the graph that has the highest height would have the most efficacy. Okay, please remember this. So अभी options देखते हैं. A, drug B is the most potent. Okay, drug B कहाँ है? It is towards the left side, extreme left पे है, and therefore it is most potent. Therefore this statement is already correct. आगे के statements देख लेते हैं. Drug C is more efficacious than drug D. Is it so? Drug C is more efficacious than drug D? नहीं. Okay, height देख लो, D की ज़्यादा हो रही है. Therefore drug D would be more efficacious than drug C. Okay, then option C, drug B is the most efficacious. Never. Drug B is rather the least efficacious क्योंकि उसकी height सबसे कम है. And last option D, drug A has the highest potency. Drug A की highest potency है क्या? नहीं. Please remember drug A has the highest efficacy. Okay, please remember it is not towards the extreme left, therefore it does not have the highest potency. Therefore the answer to this question is option A, that is drug B is the most potent drug. So हमें याद क्या रखना है इसमें से? Please remember curve towards the extreme left would be most potent and curve towards the extreme right would be least potent. ठीक है? So side determines the potency, whereas the height of the graph would determine the efficacy. मतलब सबसे ज़्यादा height वाला graph of drug would be the most efficacious drug. ओके इसके अलावा और एक चीज़ तुम्हें इंपॉर्टेंट है याद रखना, इन द लॉग डोज रिस्पॉन्स कर्व, प्लीज रिमेंबर इन द ग्राफ, ओके सो इफ द ग्राफ is a steeper curve, okay, if the curve is very steep, okay, बहुत ज़्यादा steep curve है, therefore it is an unsafe drug. Please remember, if the curve is steeper, then it is an unsafe drug. But if the curve is flatter, therefore it becomes a safer drug. So please remember, steep curve unsafe drug, flat curve safer drug. Okay, याद रखना, important. Moving on to your next question, guys, and the next question is when the pH of a drug is equal to pKa. Okay, so what is pKa? It is the isoelectric pH, please remember this, of a drug. So which of the following statements stands true? And the options are: option A, concentration of drug is 25% ionic and 75% non-ionic. Option B, concentration of a drug is 50% ionic and 50% non-ionic. Option C, concentration of a drug is 75% ionic and 25% non-ionic. And option D, concentration of a drug is 40% ionic and 60% non-ionic. So सबसे पहले ये ionic non-ionic वाला फंडा क्लियर कर लेते हैं. Okay, so please remember, ionic drug मतलब ionization हो जाता है. Okay, it dissociates into anions and cations. ठीक है, this compound dissociates into anions and cations मतलब ionic हो जाता है, मतलब polar हो जाता है compound, right? And the polar compounds are nothing but they are water soluble. याद रख लेना, ionic compounds would be or ionic drugs would be water soluble, whereas non-ionic जो dissociate नहीं होते, जिन पे कोई charge नहीं होता है, जो inert होता है, so these non-ionic compounds would be lipid soluble. Okay, these non-ionic compounds would be lipid soluble. So समझ में आ गया. So important क्या है, ionic are water soluble and non-ionic are lipid soluble. So please remember one more important thing कि water soluble जो होते हैं they can be easily excreted by kidneys. So please remember, water soluble drugs can be easily excreted by kidneys. Okay, that is very much important. Okay, इस पे क्वेश्चन था. So water soluble drugs are easily excreted by kidneys, whereas lipid soluble drugs are easily absorbed. Okay, so lipid soluble drugs are easily absorbed from the intestine. Normally हमारे membranes किससे बने होते हैं? Lipids से. Okay, therefore the dissolution is very easy. Therefore easy absorption is there for lipid soluble drugs. So please remember, if a drug is lipid soluble, it would be easily absorbed, whereas if it is water soluble, it would be easily excreted out. Okay, याद रख लेना ये. So what is the pKa? pKa is that pH of a drug. pKa is that pH of a drug where the drug dissociates 50% into ionic form and 50% into non-ionic form. ठीक है? So please remember, pKa is that pH of a drug where drug dissociates into 50% ionic form and 50% non-ionic form. Very much important. Okay. So the answer is option B over here. The concentration of a drug is 50% ionic and 50% non-ionic at the pKa pH. Okay. Moving further, guys, now. Next question is your hepatic first pass metabolism is bypassed by all of the following routes of drug administration except. Okay, so please remember, normally we know most of the drugs in the body are metabolized by what? They are metabolized by your liver, and this is known as your hepatic first pass metabolism. Okay, and if the drug is easily metabolized, okay, or it is metabolized very fast, therefore it would be less efficacious. So अगर किसी ड्रग का फर्स्ट पास मेटाबॉलिज्म बहुत ज़्यादा है, then that drug would be less efficacious. ठीक है? So please remember this. So hepatic first pass metabolism is bypassed by all of the following routes of drug administration. मतलब if we actually tend to give an oral drug, there would be hepatic first pass metabolism, right? So please remember, when we give a drug by enteric pathway, okay, when it passes via intestine, if we give it by enteric path, then therefore there would be maximal hepatic first pass metabolism. Maximum hepatic first pass metabolism is seen with oral route of drug administration. It is seen with oral route of drug administration. Whereas the other routes, that is parenteral routes, that is apart from the intestine, parenteral routes of drug administration would have less hepatic first pass metabolism. Okay, and intravenous would have no hepatic first pass metabolism, because here the drug is directly administered into the systemic circulation. So liver से इसका कोई वास्ता ही नहीं आता directly, right? So please remember, before reaching the systemic circulation, if the drug is metabolized by the liver, that phenomena is known as hepatic first pass metabolism. Okay, so please remember, and it is maximum with oral route and minimum with intravenous route. Next question. In which among the following drug poisoning alkalinization of urine is indicated? Okay, so इसके लिए एक फंडा समझना जरूरी है. Please remember this. Okay, if the drug is in the same medium, that is, an acidic drug would be easily absorbed in an acidic medium. Okay, an acidic drug would be easily absorbed in an acidic medium. Like, for example, aspirin is easily absorbed in the stomach. That is the example. Second one, a alkaline drug like morphine or like amphetamines. So alkaline drug is easily absorbed in an alkaline medium. Okay, they would be more easily absorbed in the intestine, right? So please remember, same medium enhances the absorption. Okay, ये याद रखना है फंडा में. Same medium would enhance the absorption. So इसी का मतलब क्या है? The opposite medium would enhance excretion. ठीक है, अगर opposite medium होगा तो excretion होगा, right? Absorption would be minimal. So please remember, for example, in which among the following drug poisoning alkalinization of urine is indicated? Alkalinization of urine is also known as forced alkaline diuresis. It is also known as forced alkaline diuresis. Okay, please remember this. So it would be indicated in cases of opposite medium चाहिए, right? So it would be indicated in cases of acidic drug poisoning. It is indicated in cases of acidic drug poisoning. So let's see which is the acidic drug in the below given options. Option A is morphine. I already told you it is an alkaline drug. Option B, amphetamines. Again, it is an alkaline drug. Option C, barbiturates. Yes. So please remember, barbiturates are acidic in nature. Therefore, option C is the right answer. That is, in cases of barbiturate toxicity or barbiturate poisoning, alkalinization of urine is indicated. Again, atropine is also an alkaline drug. Please remember, so only option from this is your barbiturates, which is an acidic drug, and therefore we will require forced alkaline diuresis. Important thing to be remembered, in cases of forced alkaline diuresis, what do we use? We use sodium bicarb. We use sodium bicarbonate. Whereas in cases of forced acidic diuresis कब करेंगे? In cases of alkaline drug toxicity like morphine या amphetamine drug toxicity, right? So please remember, in cases of forced acidic diuresis, we will use ammonium chloride. Moving further, which of the following drug is an inhibitor of cytochrome P450 enzymes? Okay, so please remember guys, हमें ये पता है already, there are two types of enzymes, either microsomal enzymes or non-microsomal enzymes. Important one to be remembered from pharma. So please remember, either there are microsomal, मतलब जो enzymes endoplasmic reticulum में होती है, those are known as microsomal enzymes, and those apart from that are known as non-microsomal enzymes. So you need to remember that only and only microsomal enzymes can either be inhibited or stimulated. So please remember, activation या inhibition ये बस microsomal enzymes के साथ ही होता है. Okay, it is not seen with non-microsomal enzymes. Okay, important thing. So cytochrome P450 enzymes are inhibited by, okay, which of the drug can inhibit these cytochrome P450 enzymes? So below given options are option A, phenobarbital, option B, rifampicin, option C, phenytoin, and option D, ketoconazole. So please remember, we need to remember a mnemonic for this. Okay, so let's see drug inducers. Okay, so drug which are enzyme inducers and drug which are enzyme inhibitors. So let's remember some mnemonic for this. It becomes easier to remember this. Okay, so the mnemonic for drug enzyme inducers are GPRS cell phone. Okay, the mnemonic is GPRS cell phone. Okay, so please remember, here G goes for an antifungal drug which is griseofulvin. Okay, please remember. P goes for your phenytoin, which is an anti-epileptic drug. R goes for your rifampicin, which is your antibiotic or anti-tubercular drug. Okay, S goes for smoking. Okay, C goes for carbamazepine. And lastly, phone goes for phenobarbital, again an anti-epileptic drug. Okay, so please remember this. The next, for enzyme inhibitors, what is the mnemonic? And the mnemonic is vitamin K can't cause enzyme inhibition. Okay, so please remember, vitamin A can't cause enzyme inhibition. And vitamin here goes for valproate. Okay, valproate, please remember this. Vitamin goes for valproate. Okay, K goes for ketoconazole, which is an antifungal drug. K goes for ketoconazole. Can't goes for cimetidine. Cause goes for ciprofloxacin. Enzyme goes for erythromycin. Okay, it goes for erythromycin. And inhibition goes for isoniazid. Okay, so please remember the mnemonics, both of them you have it in front of you now. So enzyme inducers कौन से होते हैं? Griseofulvin, phenytoin, rifampicin, smoking, carbamazepine and phenobarbital. Whereas enzyme inhibitors कौन से होते हैं? Valproate, ketoconazole, cimetidine, ciprofloxacin, erythromycin and isoniazid. Please remember this. Okay. So important one क्या है? इसका एक actual क्रस या summary तुम याद रख सकते हो. So please remember, in the enzyme inducers, you can see most of the enzyme inducers are your anti-epileptic drug. Except rifampicin, which is an antibiotic. Important. Second, in enzyme inhibitors, you can see most of the enzyme inhibitors are your antibiotics. Most of your enzyme inhibitors are your antibiotics, except valproate, which is an anti-epileptic drug. This is the funda to remember. Okay, please, important. So over here we can see phenobarbital, enzyme inducer, rifampicin, enzyme inducer, phenytoin, enzyme inducer. So which is the exception? It is your ketoconazole. So please remember the answer over here was option D, ketoconazole, which is an enzyme inhibitor. Rest all are your enzyme inducers. Moving further, guys, now. Which of the following statement will be true about a highly ionized drug? So I have already told you, ionized hona matlab water soluble banna, right? So ionized drug means it is water soluble. Okay, and non-ionized drug means it is lipid soluble. Okay, non-ionized means it is lipid soluble. So let's see now. Option A, crosses placental barrier easily. So as we all know, placental barriers would have a lot of lipid membranes, and for that it would require lipid soluble drug, which should be non-ionized, and here the drug is highly ionized. So this option is wrong. Moving further, it is excreted mainly via kidneys. It is a highly ionized drug, matlab highly water soluble hai. Therefore it would be exclusively or highly excreted by kidneys. Therefore the option B is right, that it is excreted mainly by kidneys. Option C, it accumulates in cellular lipids. Again, it is not lipid soluble. Then the option C is wrong. And last, option D is well absorbed from the intestine. Again, I have told you, please remember, lipid membrane se agar diffuse karna hai, then the drug needs to be lipid soluble. Here the drug is water soluble, therefore the option D is also wrong. So please remember, important point to be remembered over here. The most important factor, this question has come earlier, it can again appear in the examination. The most important factor for absorption of drug. The most important factor for absorption of a drug is nothing but your lipid solubility. Please remember, the most important factor for your drug absorption is nothing but lipid solubility. Important. Okay, very much important. Moving further now. Next question, which among the following routes of drug administration will achieve bioavailability of 100%? So first of all, bioavailability kya hai? What is bioavailability? So please remember, bioavailability, it is the fraction of a drug. It is the fraction of a drug which reaches the systemic circulation. Which reaches the systemic circulation unchanged. So important क्या है इसमें? Please remember the definition. Bioavailability of a drug is nothing but the fraction of a drug which reaches the systemic circulation unchanged. Okay, so if we are giving it by oral route, it would undergo hepatic first pass metabolism, right? So for example, you are giving 100 international units of some drug, okay, 20 units are already metabolized, so kitna hua? Only 80 international units were absorbed. So this is, I'm talking about oral route. The same would go for your transdermal route, right? Topical patches जब apply करते हो skin पे, the same it would go for your intradermal route, same would go for intramuscular route. Okay, so the only and only route where the bioavailability of a drug would be 100% is when the drug is directly administered into the systemic circulation. Okay, and which is this route of drug administration? So please remember, this route of drug administration is your option B, intravenous route. Okay, option B, intravenous route, where the drug is directly administered or injected into your systemic circulation. Therefore, the bioavailability of a drug becomes 100%. Moving forward, which among the following statement is true about orphan drugs? And the options are: option A, these drugs are not used anymore; option B, they are expired drugs and withdrawn from the market; option C, they are drugs used to treat rare diseases; and option D, these are used commonly but have high cost. So please remember guys, the answer over here would be option C. So please remember, orphan drugs are the ones which are used to treat rare diseases. Okay, so please remember, rare diseases treat करने के लिए, for example, riluzole was an orphan drug some days prior. Okay, riluzole, which is used to treat ALS, that is amyotrophic lateral sclerosis, जो Stephen Hawking को हुआ था, right? So riluzole. So some drugs which are used to treat rare diseases like this are considered as orphan drugs. So इस पे यही question आता है, only about the definition of orphan drugs. So please remember, they are used to treat rare diseases. Okay, moving further, then the image you can see in this question. Let's discuss what is the question first. So the question was, a baby was born with the deformity as shown in the below given image. The mother was on some drug therapy during pregnancy. Important, there is a history of some drug therapy during pregnancy. Which of the following drug might have led to this anomaly? So please see the image over here. What we can see, there is a congenital anomaly present in this child, and what we can see the limbs of the child. Okay, so mostly the lower limbs over here we can see. At times all the four limbs are affected. Okay, so the lower limbs in this child are what? They are just resembling the seal slippers. The lower limbs of this child are resembling seal slippers. Seal होता है ना, उसके flippers की तरह दिख रहा है, right? So the limbs of a child resemble seal slippers in a condition known as phocomelia. This condition is known as phocomelia. So please remember, if the limbs resemble seal slippers, this condition is known as phocomelia. This is a congenital anomaly and it is associated with which drug intake? The options were option A, alcohol; option B, lithium; option C, carbimazole; and option D, thalidomide. So please remember, the answer over here is option D, that is your thalidomide. Option D, thalidomide. So please remember, thalidomide is a teratogenic drug, comes in the schedule X. Okay, and it is usually avoided in cases of pregnancy because it can lead to phocomelia. Okay, so please remember, this is very much important. The other drugs are also teratogenic. Okay, alcohol, definitely alcohol intake is avoided during pregnancy. It can lead to fetal alcohol syndrome. Okay, where there would be impaired intelligence, impaired cognitive functions. Then option B, lithium, very much important. Please remember, lithium pe 2021 June session, this session, the last session, there was a question which came, right? The mother was on lithium drug therapy, and which is the anomaly that would be seen in the child. So please remember, in lithium drug therapy, the teratogenicity that is seen, it is nothing but your Epstein's anomaly. It is what? Your Epstein's anomaly. So important question, important one. So if mother is on lithium drug therapy, the child would suffer from Epstein's anomaly. Or Epstein's anomaly में क्या होता है? There is a box-shaped heart which is seen on chest X-ray. There is a box-shaped heart. And option C was carbimazole. Again, this is the teratogenic drug. So please remember, carbimazole is an anti-thyroid drug, which is usually avoided in the first trimester of pregnancy. Okay, so carbimazole, methimazole like drugs are avoided in the first trimester of pregnancy during organogenesis because they lead to some teratogenic effects or anomalies like cutis aplasia. And what is cutis aplasia? Means the skin is not formed. Okay, or there would be nasal bone hypoplasia. Okay, so please remember. So which is the drug which is usually given in cases of first trimester of pregnancy? in cases of hyperthyroidism. So please remember the drug name is propylthiouracil. PTU is preferred in cases of first trimester of pregnancy, whereas in second and third trimester carbimazole, methimazole can be given. We'll discuss this in endo properly. Okay, moving further. The next question was, which of the following drugs should be sold only on the prescription of a registered medical practitioner? So please remember, and the options were option A, Schedule H drugs, option B, Schedule X drugs, option C, Schedule J drugs, and option D, Schedule M drugs. So please remember, Schedule M talks about the manufacturing process. M for manufacturing, M for Schedule M. So Schedule M talks about the manufacturing process and all the queries related to it. Okay, please remember, Schedule M is about all the manufacturing process, whereas Schedule X is about the drugs which are not routinely used. Okay, it is about the drugs which have been withdrawn or which are not usually routinely used. Okay, and then Schedule H, this is very much important, the question has come from this earlier. Option A, Schedule H drugs are the ones which are only and only sold under the prescription of a registered medical practitioner. Please remember, Schedule H drugs are the ones which are sold under the prescription of a registered medical practitioner. तुम्हारी prescription के बिना कोई खरीद नहीं सकता. Okay, important one. Then, and there are some drugs which are over the counter drugs like PCM. They can be taken easily. Okay. Moving further to the next one. ztrack technique is used for. So please remember, there is a technique of injecting a drug, and that is known as your ztrack technique, where you pull the skin. Okay, where you pull the skin, where you stretch the skin so that the drug is directly injected into your muscle. Okay, the drug does not distribute into a subcutaneous tissue, or to prevent any leakage into the subcutaneous tissue, you pull away the skin and the subcutaneous fat, and you directly insert the syringe the needle into your muscles. Okay, and this prevents the leakage into your subcutaneous tissue, and the drug is directly injected into your muscles. And this is the ztrack technique, which is used for preventing leakage. So दो use क्या है इसके? It is used to prevent leakage in all your subcutaneous tissues, and second, to avoid pigmentation. So drugs which cause pigmentation like iron dextrans. Okay, so जब iron के injections देते हो, so that can lead to pigmentation of your skin. So to avoid this pigmentation, you can use this ztrack technique. So let's see the options. Option A, administration of nicotine patches. No, it is via transdermal route. Option B, monitoring of lithium therapy. No. Option C, administration of long-acting depot antipsychotics. Please remember, yes. So option C is your right answer. Okay, so administration of long-acting depot antipsychotics. Long-acting depot मतलब क्या? जो लंबे समय तक चले. Okay, there is a storage form. Depot means storage form. And antipsychotics, long-acting antipsychotics are nowadays available in this depot form. Okay, which almost works for around 3 months, 90 days to 100 days. Okay, and these are to be directly injected into the muscle. And there is no leakage that can be that should not be any leakage should not be there into the subcutaneous fat around them. So please remember, therefore for administration of long-acting depot antipsychotics, we use this ztrack technique. Whereas administration of Montauk's test, what is Montauk's? Also known as Montu test. Okay, so Montauk's or Montu test is nothing but your tuberculin test. It is nothing but your tuberculin test. Okay, it is nothing but your tuberculin test. And it is given via which route? The injection is given via intradermal route. The injection is given via intradermal route, and then after 1 day, almost after 24 to 48 hours, we take the reading. Okay, if the duration is more than 10 mm, then the Montu test is positive. Okay, moving further, next one. All the below given reactions are phase 1 metabolic reactions except important one. Okay, so let's see the options. So before seeing the options, we all know there are two different types of metabolic reactions which metabolize the drugs. Okay, and these two are known as phase 1 reactions and phase 2 reactions. Okay, इन दोनों का काम क्या होता है usually? Let's see this. Okay, so phase 1 reactions only attaches the functional group. In phase 1 reaction, we only attach the functional group. Please remember. Whereas in phase 2 reaction, we after attaching the functional group, we conjugate this drug. Okay, so conjugation takes place in phase 2 reactions. Okay, functional group attachment, phase 1 reaction. Conjugation, phase 2 reactions, important. Okay, so what are the phase 1 reactions? These are to be remembered by the mnemonic orchard. These are to be remembered by the mnemonic orchard. Okay, and where O goes for oxidation, R goes for reduction, matlab redox reactions together, C goes for cyclization, H goes for hydroxylation. Okay, H goes for hydroxylation, A goes for aliphatic or aromatic hydrolysis. Okay, and lastly D goes for deamination. D goes for deamination, removal of amine group. Whereas phase 2 reactions are important ones जो याद रखेंगे हम. Okay, those are known as GAMS. Okay, the mnemonic is GAMS. Okay, G goes for glucuronidation. G goes for glucuronidation. Okay, A goes for acetylation, M goes for methylation, and S goes for sulfation. Okay, adding of sulfur group. So please remember, phase 1 reaction में we were attaching the functional group, phase 2 reactions में we are conjugating. Phase 1 reaction की all enzymes are microsomal enzymes, that is they can be inhibited or induced, whereas phase 2 की phase 2 reactions की enzymes जो होती है they are non-microsomal. These are non-microsomal enzymes except glucuronidation. So please remember, the enzyme used in glucuronidation is a microsomal enzyme. Therefore, only exception in phase 2 reactions which can be inhibited or induced is your glucuronidation process. So please remember, only and only glucuronidation reaction can be either induced or it can be inhibited because the enzyme used is your microsomal enzyme. And please remember, most common phase 2 reaction is also glucuronidation. Okay, so now let's see. All the below given reactions are phase 1 metabolic reactions except option A oxidation, phase 1, option B acetylation, phase 2. So the answer here becomes option B acetylation, option C hydrolysis, phase 1, option D reduction, phase 1. Okay, moving further. Which of the following drug follows zero order kinetics at higher therapeutic doses? Okay, so please remember guys, so दो types के kinetics होता है that the drug follows. Either it can be a first order kinetics, either it is first order kinetics. So first order kinetics is always followed when the enzymes metabolizing the drug are in higher in number. अगर उस enzyme का concentration बहुत ज़्यादा है, then the drugs usually follow the first order kinetics. But if the enzyme concentration of that metabolizing enzyme is less, if the enzyme concentration is less, then the drug would follow zero order kinetics. Okay, please remember, most of the drugs usually follow first order kinetics, so उससे question नहीं पूछते हैं. Usually they ask about zero order kinetics. Okay, so what do you need to remember? याद रखना, so first order kinetics, F for first, F for fraction. So important क्या है? So in first order kinetics, the fraction would be constant, means the fraction which is eliminated would be constant. For example, there were 100 units of drugs in your in your circulation. Please remember, after one half-life or maybe 1 hour, okay, a constant fraction would be eliminated. मान लो 50% of this would be eliminated. मतलब after 1 hour there would be 50 unit. फिर से after 1 hour 50% of 50 is your 25. Then after 1 hour there would be only 12.5. So like this, okay, the fraction which is eliminated is constant in cases of first order kinetics, whereas in cases of zero order kinetics, okay, the rate would be constant. The rate of elimination which is there, it would be constant. So for example, only 20 units of drug are eliminated. So there were 100 units at first. After 1 hour 20 units are eliminated, that is 80. After 1 hour again 20 units are eliminated, that is 60. So likewise, okay, so please remember, in zero order kinetics the rate of elimination is constant, whereas in first order kinetics the fraction of elimination is constant. Important thing to be remembered. Okay, so just a minute. Yeah, so let's remember the mnemonic for zero order kinetics, and the mnemonic that we can use for zero order kinetics and which is widely accepted, it is your 0 watt power. Okay, so please remember, the mnemonic is nothing but 0 watt power. Okay, so let's write it down. What are the drugs which follow zero order kinetics? Okay, so 0 watt power. So here 0 goes for zero order kinetics, W goes for warfarin, W goes for warfarin, A goes for alcohol and aspirin, A goes for alcohol and aspirin. T goes for tall butamide. T goes for tall butamide. Next T goes for theophylline. Next T goes for theophylline. And last power goes for phenytoin. Okay, last power goes for phenytoin. So please remember the drugs which follow zero order kinetics are W for warfarin, A for alcohol and aspirin, T for tolbutamide, second T for theophylline, and power for phenytoin. Please remember these are the important drugs which you need to remember which follow zero order kinetics at higher therapeutic doses. And the options given are option A penicillin, option B topiramate, option C phenytoin, and option D valproate. So please remember guys, out of all these only option C, that is your phenytoin, follows zero order kinetics. Option C phenytoin follows zero order kinetics. Okay, whereas all the other drugs usually follow first order kinetics. Okay, yaad rakhna, important hai. Moving further to your next one. In a plasma concentration versus time graph, which parameter signifies extent of drug absorption? So let's draw a plasma concentration versus time graph. So on x-axis will take time, whereas on y-axis there would be plasma concentration. Okay, and this is the graph that we can see of a drug, for example. Okay, this is the graph. Okay, so normally the drug is gradually absorbed. Okay, the drug is gradually absorbed in the systemic circulation and it attains a maximum concentration, and this maximum concentration is known as Cmax. The maximum concentration that a drug can attain is known as Cmax, whereas in the time it attains the maximum concentration, that is known as Tmax. The time in which it attains the maximum concentration is known as your Tmax, and the area under this curve is known as your AUC. Again, it is the same, that is your area under the curve. Okay, AUC means area under the curve. And what does AUC tells us? So please remember, the AUC or the area under the curve tells us about the absorption or the extent of absorption of a drug. Okay, so please remember, it tells us about the extent of absorption of a drug, whereas Cmax tells us about the concentration, okay, or the maximal absorption of a drug, whereas AUC or the area under curve tells us about the extent of absorption of a drug. So here क्या पूछा गया है? Which parameter signifies extent of absorption of drug? And therefore it is your option C, AUC, that is your area under the curve. Okay, याद रख लेना. Then what is half-life? T half. What is this T half? So please remember, T half is your half-life. It is the time in which half of the plasma concentration of a drug would be eliminated. Okay, so please remember, it is the time in which half of the plasma concentration of the drug is eliminated. मतलब किसी drug का concentration 100% था and एक घंटे में उस drug का concentration 50% हो गया. So 50% of the plasma concentration was eliminated in 1 hour, and therefore the half-life of this drug would be 1 hour. Okay, so that is what is half-life. Moving further. Inverse agonist is defined as. So please remember, these 4 definitions are very much important guys. Easy है बहुत ज़्यादा. Just remember the questions have been asked from this again and again. And inverse agonist is defined as. So पहले definitions देखते हैं. Let us name those. So option A is drug binds to a receptor and causes maximal effect. When a drug is binding to a receptor and causing maximal effect, this is known as +1 effect. अगर cross कर रही है, then this drug would be known as agonist. This drug is known as agonist. अगर maximal action cause कर रही है, मतलब it is agonist. Drug binds to a receptor and causes submaximal action. ठीक है, partial action कर रही है, submaximal action कर रही है. Therefore मतलब 0 to +1 action कर रही है. Therefore partial action मतलब partial agonist. ठीक है, positive में action कर रही है ना at least. Therefore it would be known as partial agonist. Next one, option C. Drug binds to a receptor and causes no action. Okay, receptor को तो bind कर लिया, but it has blocked the receptor. It is not causing any physiological action. So if there is no action, मतलब the net effect is 0. Therefore this drug would be known as antagonist. Then this drug would be known as antagonist. And this is the one we tend to make mistake. The last one, option D, drug binds to a receptor and causes opposite action to the agonist. ठीक है, so it is causing actually from 0 to -1. Okay, it is causing opposite action. So for example, normally physiologically there was bronchodilation which was happening, but this drug would cause bronchoconstriction. Okay, this is known as your opposite action, and this drug would be known as your inverse agonist. This drug which causes opposite action is known as your inverse agonist. Important one. Okay, So please remember guys, maximal action, agonist. Submaximal action, partial agonist. No action at all, antagonist. And opposite action, then it is inverse agonist. Okay. Moving further, a patient has been prescribed acetazolamide in his therapy for glaucoma. As we all know, glaucoma में हम acetazolamide देते हैं, which is a carbonic anhydrase inhibitor, right? So the drug in this, the drug inhibits carbonic anhydrase enzyme, as we have discussed already. It inhibits carbonic anhydrase enzyme non-competitively. Which of the following is the effect of this drug? Okay, so please remember, here they are asking about the types of inhibition. So there are three types of inhibition, enzyme inhibition, that we need to know about. This is a common question from biochem also, and therefore it is very much important. Questions have been asked. So there are three types of inhibition. First, there is competitive inhibition. Second, there is non-competitive inhibition. And third, there is uncompetitive inhibition. Okay, so competitive inhibition matlab kya? When there is the same site for drug binding also and the inhibitor binding also. एक ही site पे drug भी bind करती है और inhibitor भी bind करता है. Okay, therefore they compete against each other. So जिसका concentration ज़्यादा होगा, जिसका substrate concentration ज़्यादा होगा, वो जीत जाएगा. Okay, so that is what is about your competitive inhibition. Second is your non-competitive inhibition. इसमें there are two different sites. One is the site for your drug and the other is site for your inhibitor. Okay, though the drug is bound to your though the drug is bound to your enzyme, the inhibitor, if binds to the enzyme, that would definitely cause inhibition of that enzyme and lead to nil effect. Whereas the uncompetitive inhibition mein nothing happens. Okay, both of them decreases. So let's see the two parameters which we need to see over here. In cases of inhibition, we actually check for two parameters, and these two parameters are Km, that is also known as your Michaelis-Michel's constant, also known as your substrate concentration. So please remember, Km is nothing but your substrate concentration. Km is nothing but your substrate concentration. Whereas the next one is your Vmax, that is a maximum velocity. Vmax is nothing but your maximum velocity. So in cases of competitive inhibition, so this is your enzyme and this is the only site where the drug also and the inhibitor can bind. Therefore they are competing against each other. So in cases of competitive inhibition, अगर substrate concentration ज़्यादा है, then what can happen? The enzyme can work. So please remember, in cases of competitive inhibition, the substrate concentration should increase. Therefore, the Km increases, whereas the Vmax remains same. So therefore, to keep the Vmax same, we need to increase the substrate concentration. Therefore, the Km would increase. In cases of non-competitive inhibition, what happens? Vmax is going to decrease in any case because there is a different site. Okay, there is a different site for the inhibitor to bind. So anyways, whatever you do, you increase the substrate concentration many folds, then also the Vmax is going to decrease because there is a different site to bind. Therefore, the Vmax decreases in cases of non-competitive inhibition, whereas the Km remains same because there is no use of increasing Km now. That is why. And in cases of uncompetitive inhibition, both of these decrease. That is, Km also decrease and Vmax also decreases. Okay. So let's see. They are asking about non-competitive inhibition, and the options are option A, decrease in both Km and Vmax. This is seen in uncompetitive inhibition. Option B, decrease in Km. Decrease in Km is seen in non-competitive. Decrease in Km, it is not seen, right? Km decrease करके फायदा ही नहीं है. Option C, decrease in Vmax. Decrease in Vmax is seen in non-competitive inhibition. So please remember, option C is the right answer. Decrease in Vmax is seen in cases of non-competitive inhibition, whereas the Km remains same, and increase in Km is seen in competitive inhibition. So I hope this was pretty clear. So please remember, inhibition is very much important. Okay. Moving further. All of the following agents act via intracellular receptors except. So please remember, there are different kind of receptors. Okay, there are different types of receptors. First are inotropic receptors. Okay, first are inotropic receptors, which are the fastest acting receptors. So important thing to be remembered, these are the fastest acting receptors. Okay. Second are your GPCR receptors. Second are your GPCR receptors, that is G protein coupled receptors, also known as 7 transmembrane pass receptors. These are also known as 7 pass transmembrane or 7 transmembrane pass receptors. Okay, because they are serpentine in nature, 7 folds होते हैं उनके. Okay, so like this. The next one are your intracellular receptors. Next one are your intracellular receptors. And intracellular receptors can be further subdivided into intracytoplasmic receptors, जो साइटोप्लाज्म में होंगे, and the next one are your intranuclear receptors. Okay, please remember this. So intracytoplasmic and intranuclear receptors. Okay, so some of them are some of the hormones in the body act via intracellular receptors. So let's see. Okay, so via intracellular receptors, the hormones which act are your, first of all, 2 vitamins act via intracellular receptors, and those are vitamin A and vitamin D. Okay, both of these act via intracellular receptors. Then all the steroids, as we all know, steroids are lipid soluble, therefore they can easily cross the membrane. Okay, they can diffuse easily via the membrane and go and act and bind to the intracytoplasmic or the intracellular receptors. Okay, therefore steroids act via intracellular receptors. Then your thyroid hormones, that is your T3 and T4, they also again act via intracellular receptors. Okay, please remember, these are the important ones that you need to remember. All the glucocorticoids, that is all the gluco and mineralocorticoids, act via intracellular receptors. This is the most important thing. Okay, so let's see, इन्होंने क्या पूछा, all of them act via intracellular receptors except, so let's see, steroids intracellular, thyroid hormones intracellular, vitamin D intracellular. So which is the only exception? The exception over here is option D, that is insulin. So please remember, insulin acts via the 4th kind of receptors which I did not discuss over here, and the 4th kind of receptors are your membrane receptors known as tyrosine kinase receptors. Okay, these are membrane receptors, उनमें एक enzyme होती है. Okay, they have enzymatic activity, therefore they are also known as enzymatic receptors. Okay, so insulin act via these tyrosine kinase receptors. Okay, tyrosine kinase receptors. And tyrosine kinase receptors के बारे में already question पूछा गया है, so please remember the mnemonic PIG. Okay, so the hormones which act via tyrosine kinase receptors are P for prolactin, I for insulin, and G for growth hormone or growth factors. Please remember. Moving further, guys, now the neurotransmitter noradrenaline acts via which of the following receptors? So we have already discussed about the 4 types of receptors. I have told you about the inotropic receptors, which are the fastest acting receptors, and over here these type are your GABA A receptors. Okay, which receptors comes under the inotropic receptors? So please remember, inotropic receptors are the ones which are attached to the ion channels. Okay, so ये तुम्हारा ion channel, यहाँ कोई receptor है, यहाँ पे अगर तुम्हारी drug आके bind होती है, then that can open this ion channel. Okay, so that are your inotropic receptors which are the fastest acting one. उसके examples क्या क्या है? GABA A, जिसपे तुम्हारा GABA act करता है. Okay, NMDA receptor और AMPA receptor. NMDA AMPA पे कौन act करेगा? तुम्हारा glutamate act करता है. So these receptors are examples of inotropic receptors. Okay, which are responsible for the excitatory or the inhibitory impulse in cases of neurons. Okay, the next one we discussed over here, enzymatic receptors. उसका example देख लिया, tyrosine kinase receptors, insulin, prolactin and growth hormones. Okay, next one we discussed were GPCR receptors, that is G protein coupled receptors, and the last one we discussed were intracellular receptors. And these intracellular receptors, please remember, these are the slowest receptors. Slowest acting are your intracellular receptors. Okay, so noradrenaline is a neurotransmitter which is there. Noradrenaline, adrenaline, dopamine, these are the neurotransmitters, and they act via, so please remember, they act via this option D, 7 pass transmembrane receptors. And what are these 7 pass transmembrane receptors? I have already told you, these 7 pass transmembrane receptors are nothing but your GPCR, that is G protein coupled receptors. Okay, so they are your membrane receptors which are embedded into the cellular or the plasma membrane. Okay, in this serpentine like fashion, and this GPCR or the G protein coupled receptors have 3 subunits in it. Okay, they have 3 subunits in it, that is alpha, beta and gamma subunits. इसको कैसे याद रखोगे? 3 दोस्त थे, alpha, beta और gamma. They were 3 friends. Okay, and there was one other friend of alpha which was attached to it, and that is your GDP. Okay, so please remember, there was one more friend of alpha which was your GDP that was attached to it. So याद रखना, alpha, beta, gamma 3 subunits होते हैं, and alpha को क्या attached होता है? GDP. So as soon as some stimulus comes, ओके कोई लड़की आ गई, सो एज सून एज सम स्टिमुलस कम्स, कोई लड़की आ जाती है, देयर इज फॉस्फोराइलेशन, ओके देयर इज फॉस्फोराइलेशन, एंड जैसे ही फॉस्फोराइलेशन होता है, फॉस्फोराइलेशन मतलब प्यार हो जाता है, उस जीटीपी का क्या बन जाता है, जीडीपी का क्या बन जाता है, जीटीपी, एंड जैसे ही जीटीपी बन जाता है, these two get separated, और अपने दोस्तों से अलग हो जाता है, ओके गर्लफ्रेंड के आने से दोस्त अलग हो जाते हैं ना, therefore alpha GTP subunit gets separated whereas the beta and gamma subunit is separated. So please remember, as soon as there is some stimulus, there is phosphorylation of these receptors, the GTP alpha subunits get separated and the beta gamma gets separated, okay. This beta gamma is your inactive unit, whereas the alpha GTP is your active unit, and this leads to the stimulation of your secondary messengers like your calcium, okay, cyclic AMP. So all these secondary messengers would be activated and which will cause the further action, okay, please remember. So this is the mechanism how the GPCR, G protein coupled receptors work. They are also known as 7-pass transmembrane receptors or serpentine receptors, and noradrenaline, adrenaline and dopamine are the neurotransmitters which act via these GPCR receptors. Moving further, calculate the therapeutic index of the drugs for which the dose response curve have been given below. So यहाँ पे dose response curve दिख रहा है, on x-axis there is dose, on y-axis there is your response. Please remember. So this is your dose response curve. This is sigmoidal in shape, right? So let's see. So दो drug के दिए हुए हैं, okay, usually. So let's see first of them. Okay, यहाँ पे हमें कैलकुलेट क्या करना है, थेरेप्टिक इंडेक्स. सो प्लीज रिमेंबर, थेरेप्टिक इंडेक्स का फॉर्मूला टू बी रिमेंबर्ड इज वेरी इंपॉर्टेंट. थेरेप्टिक इंडेक्स का फॉर्मूला इज LD50 अपॉन ED50. एंड व्हाट इज LD50? दैट इज योर लोडिंग डोज. ओके, सो लोडिंग डोज upon effective dose. Okay, so 50% of the loading dose upon 50% of the effective dose. This gives you your therapeutic index. Okay, so important है याद रखना. So what is therapeutic index actually? So therapeutic index is an indicator of safety. Important. Therapeutic index is nothing but the indicator of safety. It is the margin from which the drug is. It is the minimum concentration of the drug from where it is effective till the minimum concentration of the drug from where it can become toxic. Okay, so please remember, therapeutic index is nothing but it is the minimum concentration of a drug from which it is effective till the maximum concentration of a drug till which it is effective and not becoming toxic. So this is your therapeutic index. Therapeutic index का formula is LD50 upon ED50. Over here what we can see, यहाँ पे क्या दिख रहा है, LD50 कितना है, ऑलरेडी दिया हुआ है, it is 400 upon ED50 कितना है, it is your 100. So LD50 upon ED50, 400 by 100, it becomes 4. So the therapeutic index in the below given dose response curve is option D, that is, it is option D, that is your 4. Okay, please remember. So therapeutic index is the indicator of safety of a drug. Moving further, therapeutic index of a drug is used for assessing which of the following factors we have just discussed this. Options are A, potency, option B, safety, option C, toxicity, and option D, efficacy. So please remember, therapeutic index of a drug is used for assessing the option B, safety of a drug, right? Safety of a drug. Potency is given by the side of the curve. Left sided curve, more potent. Right sided curve, less potent. Efficacy is given by the height of the curve. Okay, ज़्यादा height, ज़्यादा efficacious. Okay, yeah. Thank you so much guys for this session, and I hope you guys have been have benefited from this session. Revision हो गया होगा general pharma का अच्छे से. So as soon as your other topics are completed from pharmacology, we will be discussing the upcoming topics of pharma also and some other subjects also. So thank you so much. It was nice to have this session with you all guys. Okay, I hope all of you have answered them correctly in your Telegram groups. So let's meet in the other session soon. Thank you so much.